As an obstetrician, it's really important that we make sure that we provide the best quality of care for women, and simulation is a great way of managing that education process. My name is Jon Hyett. I'm the Professor of Obstetrics and Gynaecology for Western Sydney University. Today we're in Lismore, which is a rural centre that we have associated with us for medical student teaching. Onto a firm surface, or if you're doing it with the end of the bed missing, you've got to make sure there's not really much of a gap. It's really important that we put things in place like simulation that allow us to make sure that people are properly trained and are confident that they have the skill set to do their job. The simulators that we used when we started were often parts of rather than a whole body, and it's difficult to engage, I think, from a communication perspective with a pelvis. MamaAnne feels very real. The skin feels very real. She's very lifelike as an individual. The fact that she talks to you and is communicating in response to things that you have said means that it's very much a interactive experience. The other features just about her design are her perineum, which is obviously quite important in terms of birthing, is really quite real in terms of the pliability of the tissue there, and the mechanism that's used to drive the baby forwards and expel the baby during the process of birth is also very realistic. So you're able really to demonstrate some quite complex manoeuvres for complications like shoulder dystocia that to some extent have been quite difficult to do on previous mannequins, and have often really been more theoretical than a direct practical application. That means that you're acting as if it is a real live situation, and I think that that has enormous impact on the whole educational pathway.